Hello everyone and welcome to Module 14. Today we're going to cover the common diseases seen in home care. So what are our objectives? At the end of the module, the aide will identify the most common diagnoses related to home care, describe the diseases and/or conditions that most commonly seen in home care, and explain the aide's role in caring for patients with certain diseases or conditions. Aides will provide care for patients with chronic diseases and/or conditions as well, as those are with acute onsets or exacerbations of disease processes and/or conditions. This module will introduce the aide to the most common diagnoses seen in home care organizations and will discuss the aide's role in caring for those individuals. So let's get started. Disclaimer: this module gathers data from all home care organizations, which includes home health care agencies, home care aid agencies, and hospices. So let's talk about hypertension. Hypertension affects tens of millions of people and contributes to death from heart and kidney disease. Treatment for hypertension does not cure it, but it controls it. According to the CDC, blood pressure consistently over 140/90 is considered hypertension. It is called the silent killer because it gives no warning in the early stages. As the disease progresses, it may cause headaches, vision changes, problems with urinary output, permanent damage to vital organs. Some people do not seek medical help until they have a stroke. There is a higher risk of hypertension if there is a history of hypertension, heart disease, or kidney disease in the family, if someone smokes, if they're overweight, if they have a high salt intake, if they're African American, if they have a diet that's high in saturated fats. Some causes are still unknown but may include, talked about diet, it could be hereditary, birth control pills, kidney infections, and exposure to chemicals. So what is the aide's role in hypertension? It is always important to follow the plan of care for the patient, help the patient comply with their medication, diet, exercise, and report back to your supervisor if the patient is not compliant. Help the patient incorporate his or her treatment into his or her daily routine. The treatment must become a regular part of the patient's day. Listen to your patient. Get answers from your supervisor if you're unable to answer any questions your patient may have. Watch for possible side effects of medications and report those immediately. These depend on the patient and the medication and could change, including the following signs. Could be stuffy nose, muscle cramps, weakness, nightmares, impotence, dizziness. So again, talk to your supervisor if you see any of those signs or symptoms. I'd like to spend a few minutes talking about individuals who suffer a heart attack or what is called a myocardial infarction. There are many medical reasons, but all result in a decrease in blood supply to the heart. If the heart tissue dies as a result, it's called a myocardial infarction. Recovery of the heart depends on the location of the MI, the person's age, their gender, atherosclerosis, the patient's health history. So what is atherosclerosis? Hardening of the arteries, which leads to a decrease in the blood supply to body tissues due to a thickening of the vessel walls. It can result in a buildup of fatty plaque and lead to complete obstruction. Atherosclerosis in the first stages can be reversed, but once the vessel is completely blocked, it usually stays that way. So what is the aide's role if someone's had a heart attack? The aide's role will involve helping a patient recover. On the patient's plan of care, it will depend on the type of heart attack they had, recovery up until that point, what is the home situation and the prognosis. The plan of care that you receive should also include instructions about what are their activity restrictions, their diet restrictions, their medication, their emotional support. Unfortunately, many people become what's called a cardiac cripple. because they're afraid of another heart attack if they themselves have experienced that heart attack or have seen another family member experience it. They will need encouragement to do some of their care and follow an exercise program. The patient may also show a total disinterest in his or her condition. The patient does not take prescribed medications or follow any of the medical guidance that is given to them. This is considered a denial of the patient's condition and should be reported to your supervisor. So I'd like to spend a few minutes talking about angina. What this is a brief temporary pain or heaviness in the chest brought on by stress or physical activity. It results from a lack of oxygen to the heart. So what are some of the causes? Narrowing of the coronary artery, which brings oxygen to the heart. It's not a heart attack, but it can lead to one if not treated. Risk factors include high blood pressure, high cholesterol, smoking, being overweight, having high stress levels. Treatment includes medications used to treat the flow to the heart, increases the flow to the heart. It is individualized for the patient's particular conditions. So control of risk factors, alterations in lifestyles. Surgery, which is called angioplasty, is done to increase the size of the artery and promote blood flow. So what is the aide's role in caring for a patient who has angina? The aide can help the patient and the family follow the plan of care. As always, it will be individualized to the patient. Talk about successes, not failures. The patient will need your support and your encouragement. Encourage the patient to return to a more healthy activity. Be alert to stressful situations. Report those to your supervisor. Report any and all complaints of chest pain to your supervisor. Your patient may take a medication called nitroglycerin that's placed under the tongue. If you see your patient taking this medication, ask them about their chest pain and call your supervisor. So let's move into diabetes. Diabetes is a condition that most of us are familiar with in some fashion. So let's talk about what it is. It results when the pancreas does not produce enough insulin to break down carbohydrates in the blood. This results in the decrease of starches and carbohydrates being used for energy and being absorbed by the cells. The sugar remains in the bloodstream and is excreted in the urine. Signs and symptoms include fatigue, weight loss, inflammation of the vagina, sores that are healing improperly or slowly, high blood sugar, sugar in the urine, frequent and large amounts of urine, excessive thirst, poor vision. Now, there are different types of diabetes. There are folks that have insulin-dependent diabetes. It's usually called diabetes type 1. It's referred to as juvenile diabetes because it occurs really in the young age, usually before the age of 36. And then you have non-insulin dependent diabetes, which is type 2. And it's called maturity onset diabetes because it often occurs after the age of 36. More than 80% of all people with diabetes have this type. There's also gestational diabetes, which is type 3. It occurs when someone is pregnant. Blood sugar usually returns to normal after the female delivers. Type 4 is caused by various reasons. It could be caused by steroids or hormone treatment. Once the drug is discontinued, the blood sugar returns to normal. Signs and symptoms usually come on slowly. Testing can be done periodically for early diagnosis and treatment. It's done through a blood sample. Blood is taken from the arm and checked for the amount of glucose present. The normal range is 80 to 120. Urinalysis, urine is checked for the presence of glucose. There's a glucose tolerance test. These are tests done in the urine and blood after a prescribed amount of glucose is ingested by the patient. Blood sugar checks with a glucometer. Most of you are familiar with that. The patient sticks their finger and gets an accurate blood sugar test, and that is a real-time actual blood sugar. There's also A1Cs, which is a blood draw that looks at a history of what that blood sugar has been over the past few months. So let's talk about long-term disorders of diabetes. It could cause blindness from cataracts, glaucoma, and hemorrhage, gangrene from poor circulation, skin breakdown, and an invasion of tissue by bacteria. It could lead to amputation. There could be kidney disease from too much sugar in the urine, vascular disease, and nerve degeneration caused by high sugar levels, poor fat metabolism, poor tissue repair, and poor circulation. So let's talk about the age role in caring for a patient with diabetes. Your role is to help the patient make adjustments to live with the disease and follow the routine of medication and diet. To notify the nurse or the dietitian, if a dietitian is available, if the patient is having difficulties following his or her treatment plan. To assist with medication reminders but never give an injection or oral medication. Insulin should be stored in a cool location away from heat and light. To notify your supervisor if your patient does not take medication as ordered or if he or she appears to be having a reaction. Include the symptoms of high or low blood sugar since the aide will need to know them. Now, those signs and symptoms are listed for you in your handout. So refer to handout 1, hyperglycemia versus hypoglycemia. Hyperglycemia is high blood sugar and hypoglycemia is low blood sugar. Patients with diabetes have a harder time healing due to poor circulation. Be sure to observe skin for early signs of skin breakdown and report this immediately. If a patient with diabetes has vision problems, assist with activities of daily living. Observe nails and toes for infection or pressure areas. However, do not cut toenails or fingernails. Be sure to give proper foot care. Bathe feet daily in warm water when assigned. Pat the feet dry, especially between the toes, with a soft towel. Massage the feet gently to increase circulation. Encourage the patient to wear clean white cotton socks and change daily. Speak with your supervisor and make sure that massage is listed on the care plan if that is an assigned task. Otherwise, do not perform massage unless it is listed on the plan of care. While it does improve circulation, we always have to be mindful to make sure that that person does not have a blood clot. Do not apply iodine or any other types of substances to cuts on the feet. Have them avoid walking barefoot. Make sure they're wearing shoes. The shoes should be comfortable, well-fitting. Encourage the patient to wear an ID badge or bracelet, which includes their name, address, phone number, medical condition, and any known drug allergies. Discuss needle disposal with your patient. Very, very important. They will need to comply with the county's landfill regulation for sharps disposal. Seek guidance from your supervisor. Ask them how do they dispose their needles. Make sure they're not throwing them just in the trash can. They should be in a hard plastic container. Again, refer to your handout for hyper and hypoglycemia. Please hit the pause button and talk with your supervisor, your educator, your mentor, your preceptor, whoever is with you, and review these signs and symptoms for what you are to look for when providing care. So let's now talk about CVA, cerebrovascular accident. This is also called a stroke. A stroke occurs when the blood supply to a part of the brain is stopped due to blocked vessels. The result of a CVA depends on which blood vessels are blocked and which brain center is destroyed. The results of a CVA may be paralysis or loss of speech or vision. Because nerve impulses do not reach the brain due to damaged brain tissue. Collateral circulation sometimes will take over the circulation for the damaged blood vessel and supply blood to the injured brain tissue. So what are the causes of a stroke? An embolus or a blood clot, which forms in the body, travels to the brain and lodges in small vessels. A thrombus is a blood clot that forms in the brain and blocks the blood vessel. Plaque, which accumulates in the blood vessel and eventually closes it. Or a hemorrhage, also called an aneurysm, where the blood vessel actually bursts, most common in people with high blood pressure. So let's talk about the aide's role in caring for a patient with a CVA or stroke. As an aide, be alert to changes in the patient's condition. It is impossible to predict when or if function will return to a body part. Do not compare one patient to another. Give personal care, follow the instructions of the physical or occupational therapist and speech therapist. The care is planned with these principles: the prevention of complications due to decreased mobility, the need for proper nutrition, safety, emotional aspects of the chronic condition for the patient and his or her family. The aide helps the patient plan the daily routine with all of the different therapies. Arrange the activities so that the patient does not tire often. Give them breaks. Give positive encouragement regarding their progress. Use simple instructions the patient and the family can understand. Show patience and understanding. Do the exercises that you've been instructed to do by the therapist that are listed on the plan of care. If paralysis has occurred, protect the paralyzed part of the body, such as the arm or the leg. If visitors tire the patient, tactfully suggest that perhaps they would leave so that the patient can rest, but only with the patient's permission. Listen to your patient and his or her family. This is often a grieving process. If you could imagine losing your functionality, so patients do grieve after a stroke. Arthritis is another condition that we often see. Arthritis is an inflammation and destruction of joints. It most often affects the shoulders, ankles, elbows, wrists, fingers, and toes. Arthritis can be due to an allergy, an injury, or an infection. Some arthritis has unknown causes. There are over 100 types of arthritis. The most common are the following. There's osteoarthritis, which is the most common type. It occurs among the elderly. After continual use, the joints and their linings become thin. The bony surfaces become thick and develop spurs. The bones rub against each other, causing pain and inflammation. Rheumatoid arthritis is a crippling chronic disease. All connective tissue in the body is affected. It usually starts in young adulthood or childhood. It is 3 times more common in women than in men. There's a spondylitis, which is more common in men than in women. It may start in childhood, but almost always before the age of 35. This disease attacks the spine and/or shoulders and hips. These patients usually remain stiff but are able to function and lead normal lives. And then most of us have heard of gout. It's more common among men. It's when uric acid crystals build up in the blood and lodge in the joints. This causes inflammation and extreme pain. Any joint can be affected, but the big toe is often the primary site. So let's talk about what is the aide's role with caring for a patient with arthritis. Remember that arthritis is a chronic condition. Help the patient establish a routine for daily care that is safe, efficient, and decreases muscle stress and fatigue. Encourage exercise and rest as ordered. Report any changes in the patient's response to the exercise routine. If the patient is trying an unconventional treatment for arthritis, report this to your supervisor. Listen to your patient. Discuss these conversations with your supervisor so that he or she may help the patient obtain professional counseling if needed. So let's talk a little bit about COPD, another acronym. COPD is chronic obstructive pulmonary disease. This refers to all diseases that cause irreversible damage to the lungs over a period of time. One of the leading causes of death in the United States. Asthma and emphysema are 2 common types of COPD. These patients have difficulty performing any activities which require exertion. They must sometimes learn to live with equipment to help them breathe. So what is the aide's role in caring for a person with COPD? Your role provides a respite or a rest for the primary caregiver. Encourage the primary caregiver to take care of the personal needs and leave the home while you're there. So why wouldn't this be true of any chronic disease? It certainly is. While we are there to take care of the patients, we are certainly there to provide respite and support for the family members. Encourage the patient to take or use his or her medications properly. Report any behavioral changes to your supervisor. Encourage the patient to eat small, nutritious meals. Check to see if fluids are restricted. Help the patient occupy their time. Encourage the patient to keep the bed in a Fowler's position. Warn the family regarding smoking and the use of oxygen. If oxygen is being used, please make sure that that patient is not and no one else is smoking in the home. Keep the home as dust-free as possible. This is so important. When we talk about like what is the role of the nurse aide and the in-home aide, personal care aide, it really is to make sure that that environment is not causing that patient to become ill. So let's talk a little bit about neurological disorders. Patients with these disorders usually remain in the home for years. There are three main diseases which require assistance with care, attention to safety, and support for the family and the patient. Parkinson's disease. Parkinson's disease is a progressive disease which affects the part of the brain which controls movement. The hands or legs usually have tremors or shakes. This patient may be difficult to transfer as they near the end of the stage of this disease process. Seek guidance or assistance from your supervisor if you have trouble with transfers. At this point, this patient may be moving from limited assistance to extensive assistance. It may no longer be appropriate for you to provide care for. We must remember that your role is to provide limited assistance, and when a patient progresses, they may need to move over to the care of a nursing assistant. Multiple sclerosis is a progressive disease which affects the transmission of impulses through the central nervous system. The first signs are usually fatigue, emotional changes, and difficulty with speech. It usually affects young adults. And then there's ALS, which is a progressive disease resulting in the degeneration of the neurons. This disease affects the nerve cells in the brain and the spinal cord. Patients may ultimately become paralyzed in the late stages of this disease, but often remain alert and oriented. Most patients will die within 3 years of a diagnosis. So you may be with a patient at the time of diagnosis, but they may progress and you may be taken off of their case. So let's talk about the aide's role in providing care to someone with a neurological disorder. The aide's role is to make sure that the medications are being taken that are in the pill box, that they're not missing any doses. Report any reactions to the medication or if the patient has changes from taking the medications. Encourage regular exercise. Report any fatigue or pain. Do not change the prescribed plan of exercise without notifying your supervisor. You can only follow the plan of care. And remember that exercises must be prescribed by a physical therapist or an occupational therapist, and you would have to be trained into those exercises. Monitor swallowing for difficulties. Food should be small enough to chew and to be able to chew easily. Make sure that the person is in an upright position when you're feeding them. Encourage the patient to be as independent as possible. Encourage participation in support groups. We often see patients with cancer. So cancer can occur in almost any part of the body. The most common sites for cancer growth are the lungs, colon, rectum, prostate, breast, and uterus. Certain factors can possibly contribute to cancer: family history, smoking, alcohol consumption, hormones, poor diet, exposure to radiation or chemicals, exposure to too much sun. Cancer can be in the form of a tumor, and it can spread to other parts of the body. Benign tumors do not usually cause death. These tumors grow slowly and in a certain area. Benign tumors are not considered cancerous. Malignant tumors. These tumors can grow quickly and aggressively. These are considered cancerous and will cause death if left untreated. Metastasis. When cancer spreads to other parts of the body from where it originally developed. Treatment options for those with cancer depend on the type of cancer. And the treatment can be surgery to remove the malignant area, radiation, which is a type of treatment that can actually kill cells, but it can also kill normal cells. Chemotherapy, which is similar to radiation in that the goal is to destroy cancer cells. However, this is done with the use of drugs. So let's talk about what is the age role in caring for a patient with cancer. The age role will vary depending on the type of treatment your patient may or may not be receiving for their cancer. If your patient is discomforted because of side effects from treatment, the patient will need adequate rest, fluid, and nutrition. Encourage your patient to eat small, frequent, and well-balanced meals during this time. Pain control may also be a part of the patient's plan of care. Be sure to follow the guidelines set forth by the physician and/or nurse, and watch for skin breakdown and changes in bowel movements. Do not deviate from what you are allowed to do with medication. So let's now talk about chronic renal failure. Renal failure is when the kidneys no longer function as usual or they become greatly impaired. Waste products are not removed from the patient's blood and fluids will build up in the body. A patient with chronic renal failure can become very ill. Some signs of chronic renal failure are leg cramps, bruises, muscle twitches, loss of appetite, nausea and or vomiting. Skin issues. The skin may become dry, itchy, thin, or brittle. Yellowing of skin, hypertension, congestive heart failure. The treatment for chronic renal failure would include restricting fluids, changing one's diet, medication, dialysis, which is the process of removing waste products from the blood. And there's different types of dialysis. There's hemodialysis, and there's also another type of dialysis called peritoneal dialysis. If your patient is undergoing hemodialysis, they would have something either inserted in their chest or it would be in their arm that's surgically implanted for the dialysis to occur. And then, of course, a kidney transplant. So what is the age role in caring for a patient with chronic renal failure? It will be very important for the aide to pay close attention to a patient's diet, especially their fluid intake. Check the plan of care for specific requirements. The aide will perform tasks to prevent many other side effects from occurring. For example, measures should be taken to prevent skin problems. Therefore, the patient will need bath oils or lotions and/or creams after each bath. Those should be outlined on your plan of care. The patient's safety is so very important, as those with chronic renal failure can have abnormal bleeding. Preventing any possible injury is a must. It would also be a good practice to weigh the patient every day to ensure fluid retention is not occurring. With the patient using the same scale each day and at the same time each day. Always report any changes in your patient status or routine to your supervisor. Remember, weighing a patient would be another skill that would need to be added to your plan of care. It is not something you do independently. These are all guides to how we can help provide care to individuals with chronic health conditions. However, each and every task must be assigned by your supervisor, and you cannot deviate from the plan of care. So today you've learned a lot. You've learned a lot of different acronyms and a lot of different conditions. These are just some of the more common diseases or conditions an aide will meet while working in home care. There are certainly many other diseases or conditions that an aide may encounter. However, it is beneficial to familiarize yourself with those that you encounter the most. Thank you for attending this session. I hope that you've added some information and knowledge so that you can provide better patient care.